Hi, okay, so thank you very much all for attending. On our presentation, we're going to be talking about emotion dysregulation within ADHD individuals and the effects of therapy. So firstly, we can start with a definition. ADHD is attention deficit and hyperactivity disorder. It's one of the most prevalent disorders in young children, affecting around 9.4% of all kids in the US, and affects mostly 12 to 17-year-olds. 3.3 million according to the CDC. It's characterized by certain behavioral traits such as concentration issues, hyperactivity, impulsivity, anxiety, and risk-taking. Since the 70s, it's been related back to emotion dysregulation. So this is the inability to control one's emotional reaction to stimuli. Even other studies such as Goodman et al. Reported a strong comorbidity with ADHD and elevated emotional regulation disorder, which is defined as emotional responses that is poorly regulated and does not fall within the traditionally accepted range of emotional reaction. And in other studies, for example, where a group of parents were asked to look after some children, they later reported that those with ADHD were 12 times more likely to be reported as having emotional lability. This emotional dysregulation can be seen through impulsivity, being quick to anger, partaking in risk-taking behavior such as extreme sports, irrational decision-making, and can lead to substance use. So some of the consequences of these effects is that it can have often a detrimental effect on a person's life trajectory. So for example, it often leads to lower academic success, lower scores on standardized tests for reading and maths, as well as high detention rate and expulsion. And even in cases here where users use medication, it can sometimes increase academic success, but often doesn't really help with standardized tests and reading math scores. In the youth prison population, ADHD prevalence is 5 times higher than in normal population, and for adults, that's 10 times higher, and 23% of individuals seeking treatment for substance abuse had ADHD. It can also increase your risk of serious car accidents through your lifespan. Some studies even reported this to be as high as 50%. So in our study, we're going to be looking at therapeutic methods to try to reduce these symptoms on an individual. We approached the issue through 2 main methods of therapy. The first being cognitive behavioral therapy. So this is trying to more impact the thought process of an individual. So for example, if they're very impulsive, we're going to try, the CBT would try and make them take longer to make their decisions. If they're quick to anger, it would help them have breathing exercises and calm down before automatically reacting. And the second part is to physically avoid situations that might elicit certain behaviors. So for example, if they have issues with substance abuse, they'd avoid clubs or parties where there's a lot of alcohol and drugs. Or if they have issues of risk-taking, which often leads to injury, then they would be suggested to not partake in like extreme sports, for example. So this is the basic model that we have seen in our lecture, and our model is based on this. Just a bit more complicated and messy. But so the main points is that in the lower section here, this is the avoiding behavior. So this would be asking them to avoid risky situations, for example. So CSD is the avoidant and CSC is normal. So we put the learning rate on the CSD to try and get them to avoid these risky situations. And in the upper side, CSE and CSA is a similar sort of concept, but with reappraisal of their thought process and trying to take time and things like that. These are then related to learning states and secondarification level to try and implement the therapy at different levels. Now, my colleague is going to speak about the simulations we performed.
Here we have a simulation. So in this case, this is an individual who is attending therapy. We can see this therapy starting at time 100 and last until time 300. After this affected behaviors, a short period, where they go up and down until it gets stabilized. This period of up and down will be where the individual needs some time to adjust what they have just learned. So it may go up, where for positive factor, they try to implement everything to learn a bit too much, then dip rather low again to show they stop doing the things they learned in the therapy until it stabilizes. Yeah, next slide. We can see that in this case, that the therapy has been successful, as the ADHD characteristic where we were trying to reduce the CSE, which represents the negative internal thought reactions to stimuli such as impulsivity, risk-taking, and quick to be angered are reduced and lower than pre-therapy states. And conversely, more appropriate thinking patterns like CSA, such as climbing oneself down, taking deep breaths, and thinking through the consequence of one's action are considerably higher than before the therapy. The second part of our learning for this study shows similar behaviors adaptations thanks to the therapy. So this is represented by CSC, which is partaking in normal ADHD-like behaviors, which may lead to issues. For example, if an individual has issue with drugs and alcohol, this would be represented by going to parties where these activities are taking place, or if they are risk-taking individuals, this would be represented partaking is risk behavior, such as extreme sports. After therapy, this line is low than it was, and the avoidant behavior, which is represented by physically avoiding this place by not attending, is higher than it was before the therapy. Next slide. Additionally, when the therapy is removed, we can see that there is no movement of any of the states. This is further evidence that the model does what it's supposed. To conclude, we can see that our model has been successful as it stimulates the effect of therapy of an individual and shows the positive impact that this can have pairing with ADHD, which could hopefully try to mitigate some of the effects caused by the disorder, which were mentioned earlier. Yeah, thank you for your listening and have a nice day.